Regulation of kidney. The function of kidney is efficiently monitored and regulated by hormonal feedback mechanisms involve the hypothalamus, JGS, and to certain extent the heart. Osmoreceptors in the body are activated by change in blood volume, body fluid volume, and ionic characters. No ionic concentration. An excessive loss of fluid from the body can activate this receptor, which stimulate the hypothalamus to release ADH or vasopressin from the neurohypophysis. ADH facilitates water reabsorption from later parts of the tubules, thereby preventing diuresis. An increase in body fluid volume and switch off the osmoreceptors and suppress the ADS release to complete the feedback. ADS can also affect the kidney function by its constrictory effect on blood vessels. This causes an increase in blood pressure. An increase in blood pressure can increase the glomerular blood flow and thereby the GFR. The JG cell play a complex regulatory role. A fall in glomerular blood flow, glomerular blood pressure, GFR can activate the JG cell. Okay, secreted by hypothalamus and stored by posterior pituitary. Or for increased formation of arbuscules. Calculated calcium level absorb. Okay. Okay. And is still released by ascending part of the handle loop, collect by descending part of pasa recta, and then released by. Okay. Osmolarity loop of handle. Okay. pH and ionic balance maintains ionic balance. Okay. PCT only ionic balance. Osmolarity ionic balance and pH, ionic balance and pH. Juncta glomerulus apparatus associated between afferent arteriole and DCT. Juncta glomerulus apparatus. Okay. Juncta glomerulus apparatus association between afferent arteriole and DCT. Regulation of blood by hypothalamus, CNS, under feedback control. BP decreases, blood volume decreases, glomerular filtrate rate decreases, blood body fluid decreases. Detect by osmoreceptors, stimulate posterior pituitary. Neurohypophysis, release ADH or vasopressin. Bind to distal parts of nephron, causing reabsorption of water. Okay. Blood pressure, blood volume, GFR, and body fluid decreases. Detect by osmoreceptor, stimulate posterior pituitary, that is neurohypophysis, release ADS or vasopressin, bind to distal part of nephron, causing reabsorption of water, affect the vessels in and around kidney and alter their function. Okay, body fluid volume increases. Blood pressure, blood volume, GFR, and body fluid increases. Affect the vessels in around kidney and alter their function. Okay. Regulation of blood by hypothalamus by renin. Regulation of blood by hypothalamus by renin, angiotensin, and angiotensin, aldosterone by heart. By hypothalamus under feedback control. Blood pressure, blood volume, body fluid volume, and glomera, okay, detect by osmosis, stimulate posterior pituitary, secrete ADH or vasopressin, bind with distal part, then body fluid volume increases, affect the vessels in the around, affect the vessels in and around kidney and alter their function. By renin, angiotensin, aldosterone system, BP decreases, blood volume decreases, GFR decreases, body fluid decreases, body ionic volume decreases. Detect by JG cell of the kidney. JG cell of the kidney release renin. Inactive angiotensin secreted by liver. Renin, um, inactive inactive angiotensinogen. Inactive angiotensinogen secreted by liver in the presence of renin convert into angiotensin 1 in lungs under the influence of angiotensin converting enzyme. Angiotensin 1 convert into angiotensin 2 active. Inactive angiotensinogen secreted by liver. Inactive inactive angiotensin Angiotensinogen secreted by liver convert into angiotensin 1 in presence of renin, then active angiotensin 2 in lungs under the influence of angiotensin converting enzyme. Powerful vasoconstrictor stimulates adrenal gland aldosterone. Okay. Binary TCD causes reabsorption of sodium. Blood ionic volume increases. Matters. When RAS is hyperactive, the walls of atria release. When RAS is hyperactive, the walls of atria release atrial natriuretic factor, vasodilator, inhibit RAS, act as diuretic hormone. Inhibit RAS, vasodilator, act as diuretic hormone. Misuration, process of release of urine. Neural pathway involved misuration. Reflex, neural pathway involved misuration reflex, process of release of urine. Bladder is full, detect by stress receptor. Bladder is full, detect by stress receptors. Signal to CNS, send to voluntary signal. Cause contraction of the smooth muscles in urinary bladder. Release urethra sphincter. Okay. Stress receptor, urinary bladder, urethra, internal, ex, internal urethral sphincter. External. Okay. Accessory excretory organ disorder. Okay. Okay. Which of the following factor responsible for formation of hydrostatic pressure during glomerular filtration, low level of antidiuretic hormone, maintaining hypoosmolality towards the medullary intestine in the kidney, secretion? Okay, C. 35. If Henle loop were absent from mammalian nephron, which one of the following is the expected? There will be no urine formation. If Henle's loop were absent from mammalian nephron, which one of the following is to be expected? There will no urine formation. Hartley and Saints. Okay. The concentration of urine depends upon which organs. Then the arrange the event of renin-angiotensin mechanisms in correct order. Activation of J-cell release renin. Okay, fall in glomerular blood pressure, reabsorption of sodium and A 38-1. Which of the following statement is correct? An excessive loss of body fluid from body switch off. An excessive loss of body fluid from the body switch off osmoreceptor. Or correct statement. An excessive loss of body fluid from the body switches off osmoreceptor. False. ADS facilitates water reabsorption to prevent diuresis. True. True. ADS will be responsible for false. BCD. BCD. Which of the following would help in prevention of diuresis? More water reabsorption due to under secretion of ADH. Reabsorption of sodium and water from renal tubules due to aldosterone. Atrial natriuretic factor causes vasoconstrictor. No. Decrease in secretion of urine. Correct. B নাহলে A. 40B. A decrease in blood pressure volume will not cause the release of. One. Atrial natriuretic factor is responsible for lowering of blood pressure and volume. The walls of atria of the heart release ANF in response to increase in pressure. It opposes regulation of RAS. Urine formation. Almost all almost almost all constituent of plasma except protein pass on to the lumen of the Bowman's capsule. JZA is a special cellular modification of DCT and afferent arteriole. Location at their contact. Follow for active JZ cell release renin. Stimulate Bowman's filtration and actively reabsorb glucose, sodium, amino acid, passively reabsorb nitrogen, source plus water. Tubular secretion help in maintenance of ionic and acid-base balance of the body fluid. Tubular secretion help in maintenance of ionic and acid-base balance. Okay. Furthermore, help to remove nitrogen. Urine 1 to 1.5 liter per day, slightly pH slightly acidic, that is 6. 25 to 30 milligram of urine is released in pale yellow color, characteristic odor. Micturition. Urine formed by nephrons is ultimately carried to the urinary bladder where it is stored till the voluntary signal is given by the central nervous system. The signal is initiated by stressing of urinary bladder as it gets filled with urine. In response, the stress receptors on the walls of bladder send signals to the CNS. The CNS passes on motor message to initiate the concentration of smooth muscle of the bladder and stimulate relaxation of the urethral sphincter, causing the release of the urine. The process of release of urine is called micturition, and the neural mechanisms causing it is called the menstruation reflex. An adult human excretes on average 1 to 1.5 liter of urine per day. The urine form is light yellow colored watery fluid which is slightly acidic and has a characteristic odor. On average, 25 to 30 grams of urea is excreted out per day. Various conditions can affect the characteristic of urine. Analysis of urine help in clinical diagnosis of many metabolic disorders as well as malfunction of kidney. For example, presence of glucose, glycosuria, and ketone bodies, ketonuria, in urine are indicative of diabetes mellitus. Glucose and ketone bodies, glycosuria and ketonuria in urine indicates the diabetes mellitus. Indicative. So gland all maximum glands produce metabolic waste except salivary and sweat gland. Role of other organ other than kidney, lungs, liver, and skin also help in elimination of excretory waste. Our lungs remove large amount of CO2, approximately 200 ml per minute, and also significant quantities of water every day. Liver is largest gland in our body. Secrete bile containing substances like bilirubin, biliverdin, cholesterol, and degrades steroidal hormones, vitamins, and drugs. Most of these substances are ultimately passed out along with digestive wastage. The sweat and sebaceous gland in the skin can eliminate certain substances through their secretion. Sweat produced by the sweat glands is a watery fluid containing NaCl, small amount of urea, lactic acid. Okay, sweat glands, small amount of NaCl, urea, and lactic acid. Though the primary function of sweat is facilitate a cooling effect on the body surface, it also helps in the removal of some of the waste mentioned above. Sebaceous gland eliminates certain substances like st- okay, sterols, hydrocarbons, and waxes through sebum. This secretion provides a protective oily covering for the skin. Do you know that small amount of nitrogenous waste could be eliminated through saliva too? Malfunctioning of kidney can lead to the accumulation of urea in blood, a condition called uremia, which is highly harmful and may lead to kidney failure. In such patients, urea can be removed by a process called hemodialysis. Accumulation of urea in blood, a condition called uremia, which is slightly harmful and may lead to kidney failure. Urea can be removed with the process of called hemodialysis. During the process of hemodialysis, the blood drained from convened artery is pumped into dialysis until called artificial kidney. Okay. Renal calculi, stone or insoluble mass of crystallized salt oxalate formed within the kidney. Stone or insoluble mass of crystalline salt. Stoned or insoluble mass of crystalline salt. Glomerulonephritis, inflammation of glomeruli of kidney. Inflammation of inflammation of glomeruli of kidney. Renal calculi, stone or insoluble mass of crystalline salt. Renal failure, kidney transplant is the ultimate method in the correction of the acute renal failure. Many nitrogenous contained substances. A condition of failure kidney to form urine is called uranema. Anuria. Presence of RBC in urine. Hematuria. Use of artificial kidney during hemodialysis may result in nitrogenous waste buildup in the body, non-elimination of excess potassium ion. Use of an artificial, okay, reduce absorption of calcium ion from gastric RBC production. CND, reduce absorption of calcium ion from gastric, okay, reduce RBC. Transport of urine, storage of urine, urinary bladder. The ultrafiltration, Malpighian corpuscle, concentration of urine, Henle loop, transport of urine, urethra. Okay. Human urine is usually acidic because potassium and sodium exchange generate acidity. Actively secreted into the filtrate, the sodium transport exchange hydrogen ion. C. B. Hydrogen ion are actively secreted. Which of the following does not favor the formation of large quantity of dilute urine? Which of the following does not favor the formation of caffeine? A. serotonin.